my name is Dr. David Traster, and today we're going to talk about photobiomodulation and concussion. Photobiomodulation is just a fancy term meaning the use of light to try to modulate or change brain activity in hopes to optimize or change brain function to reduce symptoms or optimize performance. Traumatic brain injuries are a major cause of death and disability and a significant public health problem in the United States and worldwide. Traumatic brain injury is defined as an external force-induced injury that may impair normal brain functions such as movement, memory, sensation, and emotions. Traumatic axonal injury is one of the primary pathophysiologic consequences of impact and acceleration injuries to the brain, meaning that the wiring that connects one area of the brain to the other gets injured and the communication between the brain gets altered. White matter tracts, meaning the wiring in the brain, are particularly vulnerable to concussions or brain injuries, which may manifest as chemical and mechanical changes in the areas or the neurons or the brain cells. While these changes could trigger cell death and consequent neural disconnection, they may also resolve, leading to partial remyelination or healing and even full recovery. And so when you look at concussions many times affect the wiring or the communication between different brain areas. And when those communications get altered or get disrupted, it could lead to either cell death and death in the brain, or it could lead to partial or full recovery, depending on a lot of variables. Therefore, the therapies that you can do after a concussion are important to try to recover healing in the brain and to try to reduce as much cell death as possible. There's a lot of evidence that has shown that the brain has extensive ability to reorganize and heal after a concussion or brain injury. Low-level light exposure over the brain is thought to include beneficial vascular or blood vessel and brain effects. It seems that photobiomodulation decreases inflammation and increases the neuroprotection after a concussion. Light therapy or photobiomodulation leads to increases of cellular energy, blood flow, antioxidants, while decreasing the inflammatory metabolic process by modulating the immune system, allowing protection against cell death. Most of us think that light-sensitive molecules or cells are only in the eyes, but we know they're in the eyes, they're in the red blood cells, they're in the muscle, and then there's a cytochrome area in all cells, which actually is a receptor that takes in light. And so cytochrome is the molecule that explains how light therapy can help in so many conditions, because it converts light energy from the external environment into energy from the cells called ATP. For most of this light energy is absorbed by the powerhouses within the cell called the mitochondria. Light triggers ATP or energy production, which is why it can initiate and accelerate the repair and growth of healthy new cells. So light can trigger energy production within the cells, which is why it can initiate and accelerate the repair and growth of healthy new cells. Photobiomodulation can also act to reduce swelling, increase antioxidants, decrease inflammation, protect against cell death, and modulate immune function. All these mechanisms of action strongly suggest that light therapy delivered to the head and/or research is showing on the body should be beneficial in cases of both acute and chronic concussion or traumatic brain injuries. There is evidence that photobiomodulation can help the brain repair itself by stimulating neurogenesis, or the creation of new brain cells, upregulating BDNF, which then encourages the increase of new connections in the brain, or synaptogenesis. In healthy human volunteers, including students and healthy elderly women, photobiomodulation has been shown to increase regional cerebral blood flow, tissue oxygenation, and improve memory, mood, and cognitive function. Clinical studies have been conducted in patients suffering from the chronic effects of TBI. There have been reports of improvements in executive function, working memory, and improved sleep. Functional MRI has shown modulation of activation in intrinsic brain networks likely to be damaged in traumatic brain injury, such as the default mode network and the salience network. In a case study of a post-concussion patient, after 8 weeks of photobiomodulation, there was shown to be increased brain volume, improved functional connectivity, and increased cerebral perfusion and improvements on neurophysiological test scores. Photobiomodulation has strong evidence for many beneficial effects on traumatic brain injury and stroke in both animal models and human patients. Both acute stroke and acute TBI have a growing number of studies being published showing that photobiomodulation is an effective means of treating both of them. Research has shown that light therapy can result in neuroprotection and help prevent the spread of brain cell death after a concussion or brain injury when light is given as close to 4 hours post-injury. Protection against toxins, increased cellular proliferation, and reduction of cell death, and anti-inflammatory and anti-edema effects may also contribute to the mechanisms that underlie the benefits of photobiomodulation. The most exciting prospect is the possibility that photobiomodulation may stimulate both neurogenesis, the ability of the brain to repair itself, and synaptogenesis, encourage cells to form new connections with each other. And here are the references we use for this lecture. So I hope this gives a little more information about how light, sometimes laser, can be used on the brain or the body to try to stimulate cells and energy within the cells through the mitochondria to improve the function of the cells, and whether that's in the brain or the body, which then leads to anti-inflammatory effects and can lead to other positive effects or optimization for both the brain and the body. Thank you.